Our donor program is 19 years old. The personnel that runs the program is very experienced, and it is involved with the program from the very beginning, from the establishment. We have a large number of donors, and that makes it much easier for us to find the right donor for the right recipient, and it reduces dramatically the waiting time that we have for the recipients. Most of the times we can provide a donor for a patient in a period of time less than 3 months. The maximum time is approximately 6 months. We have the ability to screen the donors very carefully and either reject them at the early stages of the recruitment process or consider them as potential donors quite early. Then we proceed with complete evaluation of the donors, which involves psychological testing by psychologists, genetic testing, both blood tests as well as genetic counseling to determine whether or not there are any conditions in the family that might be transmitted to future generations. The donor is also evaluated for her health, and any donor that has any questionable history or any health problem is rejected. After the preliminary evaluation is completed, we do all the necessary testing mandated by the New York State as well as the FDA, and once the donor passes all the tests, then it is considered a donor for the Fertility Institute and can be used for the treatment of our infertile patients that need donor eggs. Because they seek help later in their reproductive years, a large number of patients have poor quality eggs or small number of lesser quality eggs, and treatment with donor eggs is the best option for them to conceive and have a child. We have utilized frozen eggs, and we have achieved pregnancies and deliveries from our donors, and we believe that in the future, as this technology improves and the results improve and the experience of the patients increases and acceptance of frozen eggs increases, we will utilize these more and more. That will help us make it much easier for the recipient and our center to coordinate the care of the patients without the restrictions that we face today to coordinate the lives of two different individuals, the donor and the recipient.